Good morning, Cho Boing Sang, Toyat, Wiki, Dok Choilai, Dat Nok, Vietnam, Zindep. It's an absolute privilege to be here in Vietnam, and I'd like to thank the HMA team for this kind invitation. For those of us who are not very familiar with the rapid strides that Vietnam has made since the reunification 50 years ago, I thought I'd just take a couple of minutes and really acquaint everyone with something that is truly impressive. Vietnam now is the 33rd largest economy in the world in terms of nominal GDP, 26th largest in terms of purchasing power parity, and with a population of 100 million, very young population, the future actually points towards Vietnam. The growth rate has been very impressive, 7%, 2024, and has been averaging between 6 and 7% for more than 3 decades. And if we look at healthcare, some very impressive gains. If we just look at infant mortality, which was 118 pre-reunification, it's down to 14. So that's really dramatic, from 118 to 14. If you look at maternal mortality, again, very impressive, from 336 down to 48. Life expectancy has gone up from 62 to 76. And while the median age is 33 today, in the years to come, the country will have to plan on how it's going to look after the elderly population as well. In terms of medical tourism, growing at the rate of 12% annually, about 300,000 medical tourists visit Vietnam, and this generates about $2 billion. Huge amounts of potential there as well. So to discuss, all these exciting developments and where is it that Vietnam is headed, we have this session, From Vietnam to the World, Building Centers of Excellence in Southeast Asian Healthcare. And we have a stellar group of experts here who are going to be sharing their perspective with us. So Natalie's already introduced all the speakers. So what we're going to do is request each one of them to tell us a little bit about their organization, and then we will get this panel going. So I'm going to move there and get this started. So we're going to start with Niru, and of course, he's based in New Zealand, is the CEO of this new company. And the one fun fact that I learned about him is this fitness and gym routine that I think many of us can learn from. And he's very interested in cricket and basketball, and I think the fitness shows there, Niru. So tell us a little bit about your organization first.
Sure. Can everyone hear me? Yep. Thanks for that introduction, Anupam. It's great to be here at HMA. What an atmosphere. Absolutely lovely. I'm from New Zealand, which is a very small place in the corner of the earth, for those who don't know. My name is Niru Rajakumar. I'm the CEO of Amalga. We're a recently launched spin-off company. We provide the next generation of hospital information systems. And we've spun off from a company called Orion Health, which is a Kiwi-owned New Zealand company. And we have been in this market for over 15 years, focusing around hospital solutions and streamlining hospitals and the operations and providing workflows to clinicians across Vietnam, Thailand, Philippines, and New Zealand.
Thank you, Niru, for that. I'm going to ask Ms. Lien, who of course is the group CEO of Hoan Medical Corporation, lived in Australia for 15 years and then came back to Vietnam and has created a phenomenal company. And something we discovered is that she loves music, and I think we should get her to play the guitar at some point in time.
Thank you. Good morning, distinguished guests, ladies and gentlemen. First of all, I'd like to thank HMA for the opportunity for me to be a panelist today. I wish you all the best. My name is Lien, the Group CEO of Hoan Medical Corporations. We are the largest private healthcare network in Vietnam. We got 15 hospitals and 3 clinics. We operate under several brands: Hoan Mỹ Hospitals and Clinics, Hoan Mỹ Academy, and we also have the Hạnh Phúc International Hospitals and Clinic, and we also have another brand called Thuy as well. So we operate in 9 different cities and provinces in Vietnam. And we serve about 5 million patients a year. Our capacity is about, we have about 3,000 beds. We offer services from basic healthcare to complex procedure and surgeries. And we serve, we bridge the gap where the public sectors cannot meet. So in terms of serving the people who use the national health insurance programs, but we also serve the middle and high income earner as well. So, and then in addition to that, we also serve people coming from overseas, not just Vietnamese overseas returning home for treatments, but also medical tourists, especially in some cities where there are a lot of tourists, like beautiful Da Nang. And then also in Ho Chi Minh City, we serve people from a neighboring country as well. And this year, we also very proudly can announce that we have recently achieved the accreditations from the certifications from Australian Council of Healthcare for the entire network of all our hospitals and clinics, ACHSI, that we received the certifications for the whole network. I will share a little bit more about that later in our discussions today.
Thank you. Thank you. Thank you for that, Ms. Lien. And I'm going to request Ms. An, who's the chairwoman of the CEO Vinmec International Healthcare System, to tell us a little bit about her organization. Of course, she was instrumental in getting the JCI accreditation for the facilities in Hanoi and in Ho Chi Minh City, has more than 20 years of experience, loves to read, watches thrillers, and unresolved documentaries. So if you have any suggestions for unresolved documentaries, Ms. Ann will be very happy with some suggestions. Over to you.
Yeah. Well, I will share that with you in private. I do have a list. Well, thank you, Professor Anus, and a very great good morning to everybody's in the rooms today. But thank you, HMA, giving me this opportunity to share, to sit here and share the experience with everybody. My name is Thuy. I've been working in private healthcare management in Vietnam for over, nearly 30 years by now, in different international and private facilities. My main experience is mostly with private healthcare, and within 30 years, I've been witnessed how private healthcare develops and grows and established in Vietnam. It is a very nice experience seeing how private healthcare contribute to the development of local healthcare network. Now, Vinmec healthcare system has been established since the year 2011. The visions since day one is to become an academic healthcare system, moving into value-based achievements. And a focus with a very strong focus on quality. Since even before the very first hospital is putting into operations, when we do our very first architect layout, we already got support from JCI to review the layout. We learned about how to standardize on the flows. Until now, we have 9 hospitals throughout the country. I think we are one of those healthcare systems in Vietnam that having our national footprints stretching out the country from the Hanoi capital to the Mekong Delta at this point of time. We do serve. We do have our medical university, which is currently doing MD and nursing educations. And we do open our residency programs for the last 5 years. We are moving, we do have a very strong research wing as well. We do have genomics and stem cell research programs in Hanoi, core lab systems in Hanoi, an immunology research based in our medical university, working alongside with our clinical teams. we do have a biobank with AABB accreditations. But a little bit about our clinical programs. We, with all that in mind, we have been accredited by different disease management accreditations like ACC for cardiologies, CAP for the lab medicine that we were just discussed a few minutes ago, and a few more. So we are looking forward to have a very strong pipeline development in the next few years. By the year 2030, we probably would have 17 hospitals in Vietnam and a very strong primary clinic chains to support the primary care models in Vietnam. So that's all about Vinmec. Thank you.
Thank you, Ms. Ann. And we're going to now move on to Dr. Truong, who is the Deputy Chairman of the Strategic Committee of Ho Lam Shangri-La High-Tech Healthcare Park Ho Lam Group, Vietnam. He's a specialist in metabolism and intensive care and also a member of the Center for Innovation in Health Management at the University of Leeds. Dr. Truong, for those who don't know this, but is a very keen table tennis player, and he plays regularly in the club, and when he can't get to the club, he's put a table tennis table in his hospital, but the only problem is no one wants to play with him, one, because he plays so well, and secondly, he's the boss. So if you have any suggestions on how he can get partners to play table tennis with him, that would be very welcome. Over to you, Dr. Truong.
Thank you, moderator. By the chance, this morning I would like to say thank you to the HMA, because I involved in the HMA from 2009. At that time, I discussed with the Ministry how can we hold HMA in Vietnam. And then, based on the support from the Ministry we hold the first time SMA in Ho Chi Minh City. And the second time we hold SMA in Hanoi, 2012. In 2016, we hold another SMA in Ho Chi Minh again. And then the fourth time we hold SMA in Hanoi. And this year is the fifth time we hold the SMA. Thank you, Richard over here. Regarding the Ho Lam Shangri-La, now we are the healthcare investor. The Ho Lam Group, we invest in 5 industries, including the banking, finance, real estate, education, fintech, electronic lottery, and also in the healthcare. Now, the main industry, we focus on the healthcare industry. In Ho Chi Minh City, we invest in the high-tech healthcare park in Ho Chi Minh City with the land area 37.5 hectares. And now we put 2 hospitals in operation already. That is the City International Hospital and the Yang 115 Hospital. 2 hospitals, we got accreditation by the AACI, American Standards. Because now American standards, they follow the JCI and AACI. And the City International Hospital with the capacity of 320 beds, we put in operation from 5th January 2014. Now this hospital, we focus on the women and children. We have the IVF center. At the Yang 115 Hospital, we focus on the geriatric specialty with the high-end technology. And we also signed a collaboration with Siemens to invest all the high-end technology regarding diagnosis. And we also just launched the photon shock VV30. It's a calculate around 100,000 slide CT scan. And now the next step, we focus on the medical tourism. And now we have a comprehensive high-tech healthcare park. We have a shopping mall. We have education. We have a hospital. And we also invest in the stem cell that is the future for the medicine regarding the personalization medicine. And the next step, we will invest in the comprehensive cancer hospital. Thank you.
Thank you so much. And I'm going to invite our 5th expert, Dr. Guillon. He has more than 40 years of experience, received training in France, and has been the hospital CEO of FE Hospital since inception. has worked in Paris, has worked in West Africa and Saudi Arabia and Brunei. And he's been in Vietnam for 25 years, loves the country, but is still struggling to learn the language. So if you can help him in that, that'll be very, very welcome. Over to you, Jean-Marcel.
Thank you. Good morning, everybody. Thank you, the HMA, to have invited me. It's a pleasure to be here. Attended HMA meetings, I don't know, probably as long as you, since the late, I think the first time was in Manila in 2005 or something like that, a very long time. And I learned a lot of things through the different times I came to HMA. So it's always very interesting. So I am the CEO of Heavy Hospital. We don't have a large group like Vinmec or One Me. We are a single hospital. We were the first foreign invested hospital in Ho Chi Minh City. We created this hospital in 2003. And the purpose of it was to create a patient-centered, high-quality, premium private hospital. And we have been now open for nearly 23 years. We see about 250,000 patients a year. It's a multidisciplinary hospital with more than 30 specialties. We do almost everything, and we are developing a number of centers of excellence, particularly cancer, maternity, joint and bone, and other centers. And we are passionate about what we're doing. We have a great team of doctors, most doctors from Vietnam, of course, and our patients are 80% Vietnamese. We have a number of Asian expats and Western expats coming as well, and a number of medical tourists, and I will talk more about that in a minute.
Thank you. Thank you so much. So as all of us heard, lots of exciting developments happening, lots of expansion across primary, secondary, tertiary, quaternary care, improving standards, looking at research, looking at some innovative therapeutic areas like stem cells, looking at medical tourists. So thank you so much for sharing information about your institution. So I'm going to get on to the first area that I think we want to discuss, which is really looking at quality benchmarks which are global, and how is it that we can bring that into local healthcare. So I'm going to ask Niru first and give us a perspective from where you are sitting on how that works.
Sure. Thank you for that. From my perspective, being out of New Zealand, but also seeing the world in front of me, right across, not only in Asia Pacific, but across Europe, Middle East, North America, South America, the key for me is that local institutions or hospitals in each country can really work together in partnership with global hospitals or global organizations. And first and foremost, the key to do that is to understand the common problems that we're facing in these countries and how some of these global organizations have faced these challenges and have either resolved them or are driving and being motivated to resolve them. And the first thing as part of that is actually, where are the best practices that some of these global organizations have addressed some of these challenges for local. And for example, I'll touch on Vietnam. From what I can see and what I'm hearing is that there's clearly a challenge around capacity in hospitals. Hospitals are stretched over capacity, some cases between 150 to 300%, where patients are sharing beds. That's not an optimal place to be in. It's not only a challenge in Vietnam, it's a challenge I see across the globe, but it is a key challenge. And then the other spectrum, the doctor to patient ratio is unbalanced. I'm seeing a global OECD of about 36 to 10,000 patients. Locally here, it's about 15. And then when I overlay that with the trend of non-communicable diseases that are actually taking 80% of the impact in Vietnam, such as diabetes and heart disease, but the system is still geared towards acute care, we need to do something more. And this is where organizations that I've seen globally can really share their learnings and best practices around how they've addressed some of these problems. And we heard that from the keynote speaker just earlier around shifting left and actually thinking about preventative care. So that is a good starting point. But also along the way, how can we actually take the lessons learned from the implementation of these best practices and applying them with the local hospitals of their cultural context, their agility, the language is all very important. So ultimately, partnering hand in hand is very important for that.
Thank you, Niru. I'm going to ask Ms. Lien to share her perspective on establishing quality benchmarks in local healthcare that really truly meet the global standards.
Thank you, Professor Anupam. In yesterday's presentations, Dr. Thuy, the Vice Minister, Ministry of Health, and also Dr. Đức from Ministry of Health talk about all the challenges facing the healthcare industry in Vietnam, and also to share that we ask here, all four of us representing the private healthcare industries in Vietnam here. We, in terms of numbers, we account for about 25% or 25% of number of hospitals. But in terms of the beds, number of beds, I think we serve about 5 or 6%. So, but we increasingly become an important player of the industry. And then, fortunately, that the government is really giving us, more attention, also encouragement in developing the private sector. Because we're not just only bridging the gap for the public sector, but also providing, the standard, the quality services that actually not only meeting the needs, but also approaching international standards. So at Hoan Mỹ, I can share in particularly that way we have established for the last 28 years and operating in Vietnam for the last 28 years, mainly serving the local Vietnamese, but also serving the overseas, the expat communities here and the tourists coming to Vietnam as well. So what we see here in our group is we over the years we are increasingly improve our facilities when we renovate or we buy purchase equipment or procure the solutions. We always, of course, benchmark with the Ministry of Health requirements and standards, but we also look out for what are the best practices and things we can learn from other countries. Take an example, even from the beginning when we now, especially in 2024 and 25, we largely renovated our network. When we do the stack planning, where we do the layout of the floors and then do the design of the OT room, we take into consideration what we learn from the best hospitals in the regions and as well as in other, in Vietnam as well. So then we also establish in very strong governance in terms of what equipment we're going to buy. And then, just an example, we last year and also last year we were the first one in Vietnam, investing in the latest MRI equipment in Vietnam after Singapore. I think that the GE 3.0 that we got from GE there. So we want to bring into Vietnam what is the latest technology out there. And then also when it comes to quality, so we improve the facility, we got the latest equipment, but we also look at other solutions, like we got the automated lab in Hoan Mỹ, Saigon, which is the best solutions. I think one of the very few locations got the automated system in Vietnam. Then we know that customers come to us because of clinical quality. And that is our focus, to talk about how we can improve the clinical quality. And then not just only meeting the MOH standards, because our hospital usually among the top hospitals in that region to achieve the highest mark for highest score for MOH, but we also think about how we can adopt the international accreditations in Vietnam. That is why Hoan Mỹ has been implementing the Austrian Council for Healthcare Standards. And we have recently applied across all of our hospitals and clinics. So during that process, we assess our situations and also build our capacity, how to improve that. And because we have a large network of hospitals and clinics throughout the country, serving the people from the central north of Vietnam up to the very end of Vietnam, in Cà Mau. And then also we have very big centers in the Mekong Delta, in Ho Chi Minh City, and in the Central Highlands, and in the central Vietnam as well. So we want to standardize all our practices, and the ACHSI, the standards we adopt from Australia Council of Healthcare, that help us to standardize our practices, and also importantly, that help us to improve the compliance and improve the patient safety. And first and foremost is changing the culture. What we see is we not just only improve the patient safety, but we also improve the quality of care. And at the end of the day, when the outcome is better, the quality of care is better, the efficiency is better, and also customer satisfaction is also better as well. We see that happening throughout the survey from the customer, and also even reflecting that in the scoring from the MOH. And at the end of the day, adopting accreditations is not just only doing it for the fact of having the title. It's really a journey of improving the customer service, journey of improving patients' care, and also changing the culture of embedding, empowering, embracing the safety, and then also change the culture that people are willing to talk about issue and how to fix it. And this is this important thing that I think that's what we have accomplished, but it's something that I see is in healthcare organizations is important to have. And it's also in our journey of having Vietnam to become a destination for people to come and work with us, especially when we build on our center of excellence and for the highly skilled specialties.
Thank you so much, Ms. Lien. Some very important points you made about empowerment and about embracing change and looking at the best anywhere in the world and making it your own. So thank you for that. I'm going to request Ms. Anne for her perspective on quality benchmarks locally that meet global standards.
Well, thank you very much. And well, I would just add a little bit more to what Ms. Lien's statement just now is about the role of private healthcare, because we are a private healthcare institution. So we consider ourselves as an extended arms of the local healthcare networks in Vietnam. So we cannot replace, and because we are private, we will not be able to serve the entire populations, because our bed capacity is just that much. So what we've been trying to do is that we would like to be in our ability play a catalytic roles in looking at the trends of medicine evolvements and trying to establish such model, including the quality model, so that we can help the Ministry of Health and the local healthcare network to replicate the best practice. So what we have been doing at Vinmec Healthcare System is exactly what I shared just now. We start from JCI as a safety management foundations for the hospital, and then we look into the situation, and then we think that we have with the Niru, as you said, the non-communicable disease increase in Vietnam. Plus, we have an aging population, so we have to look into disease management and health management more than just acute and symptom treatments. So, because of that, we start to brought into different standardization. I mean, professionals, clinical standardization, as I mentioned. So at Vinmec, what we think is now the first thing we do when we talk about quality, we start from establishing the models, IPU, integrated practice unit, as we all share, and we standardize and we change the habit of practice of the physician and the nurses based on the team-based and multidisciplinary approach, so that we can provide a holistic health management and disease management to our patient. And most important, which your areas play a very important role, is a very functioning EMR that help us to collect the data and and monitors so that we can have the baseline for improvements. I think we've been doing PRAMs. Of course, everybody, every hospital is doing PRAM for a long time. Now we move into, with the IPU, we move into PROM, patient report outcome measurements. And when we do that, we will need to look at the indicators and the outcomes and measure it and then analyze why does it happen this way? What can we do better for this particular individual as a patient? I mean, this requires a very strong support from ITs, EMRs, and a few more. So that is how we look at how do we bring international quality to standardization to the local context so that we can, and I think it is the only way, standardization is the only way. We know exactly where we are and how we can improve ourselves and how we can bring international healthcare standard, bring the world to Vietnam and then bring, push Vietnam to the world through the standardization and qualities management. Now, the last thing that I would like to share is, well, Ms. Lien talked about culture. Well, culture is very important. The change management is actually, we change the culture. We manage the change of the culture. We change the habit in practice. It's actually changing the cultures of practice of the physician and the nurses. So I think, but in my personal opinion and what we practice in Vinmec is that culture starts from leadership. And the leader has to walk the culture. We talk about safety. So we would need to, besides what Ms. Lien says, is that we empower everybody to speak up, to analyze the risks and everything. Now we have to set up a governance culture structure is that it's facilitate that. At Vinmec Healthcare System, we do have, even now we have 9 hospitals throughout the system. We practice safety, a daily safety huddle. Everybody is virtually 30 minutes per day for all hospital management to review what is the safety issues and what is the incident throughout the system during the last 24 hours. We review clinical incident and then any operational problems that can cause bad experiments for the clients. Or, we review every feedback, negative feedback of the patient so that we can improve. We do it on a daily basis. And of course, every CEO of any hospital is requested to do executive walk and then to do safety walk so that we know exactly what is happening in every corner of the organizations. So to share with you, that is how we practice international standardizations and quality management in a very simple approach at Vinmec Healthcare System.
Thank you so much, Ms. San. It's so important that you highlighted the cultural changes and when you adapt, you have to have the cultural adaptation and the walks, the rounds, and of course the huddles are very, very important. But how they're conducted is so central to whether it's accepted by everyone in the team or not. And that's such an important point you make. And also about patient-related outcome measures, because that's really what patients are interested in. Because sometimes there's a huge difference. Let's take, for example, prostate cancer. And a radical prostatectomy done, and the urologist, his perspective is, well, this patient's not going to die because of prostate cancer, which is great. But you're not expected to die after prostate cancer surgery. But what matters to the patient really is incontinence. And if they're not going to have urinary incontinence issues, then for them, that is really what is more important than anything else. Absolutely. So it's extremely important to put the patient really at the center of whatever we are measuring. And this whole movement towards PROMs is just so positive. I'm going to now request Dr. Long to share his perspective on leadership, on sustaining leadership and on talent development and what do you see is the future there?
We turn back the topic, the title we discussed this morning regarding how can we have the healthcare revolution. Vietnam, only one country of the Southeast Asia. And what is the future? We put the patient-centered care. Because so far, after 50 years, the healthcare industry in the Southeast Asia, we have a lot of change. That is a big revolution. We invest a lot of modern machine, even the standards. But the most important, that is how can we put the patient at the priority for our service. That is the future of the healthcare. Because so far, when we talk about the patient care, we only talk about the machine, the lab, even we talk about the finance, revenue, sure. Because even the public or private, we have to focus on the financial issue. But the future of the healthcare should be the patient care, patient-centered care. But how? How can we do that? Because so far, not only in Vietnam or in the private sector or the public sector in Vietnam, we have a 4 problems regarding the patient care. The first, regarding the fragmented. Because when the patient they go to the hospital, they don't know where they have to go. No connection from this department with the other department. The second, and regarding the data of the patient. We have no connection between the outpatient or from the clinics to the hospital. After the patient discharged from the hospital, we have no connection to the post-discharge service. The third, that is the communication. The medical staff and non-medical staff regarding the communication is limited. That's why we have to face with the problem. When the patient, they have any issue, they would like to sue the hospital. And they ask, they have no understand what the hospital staff explain to them. But how is the chance we can improve that issue? I think the next step, we try to focus on the data. We talk a lot about the digital transformation. That means we have to invest in the EMR, the health, electronic health record. And when the patient they go to hospital, we have all information, not only in that hospital. And how can we connect between the public and the private sector? When the patient they transfer from one hospital to the other hospital, we have all information of the hospital. And regarding communication, we have to train our staff, not only the doctor or the nurses. We have to train our security, non-clinical staff. One, for example, when the patient they go to hospital, they go to the cashier, they do the payment. But the cashier, they only focus on how can they receive the money from the patient. But they don't know how to have a good communication with the patient, with the customer. And how? What is the solution? I think regarding how can we build the Asian healthcare, the Southeast Asia healthcare, become the hub of the healthcare of the Asia. We need to standardize. That is, we talk about the standards. And then we have to put the patient first. And all the decision maker, when we set up in a hospital, we have focus on the patient first. Because now that's why now we only talk about the patient first. But all the decision maker, when we issue the policy, we don't focus on the patient. We only focus on the benefit of the hospital. That is the problem. I think the next step, when we would like to have a breakthrough, that it look like the revolution of the healthcare service in the Southeast Asia, we have to do the right thing. That is the patient care service. That's all.
Thank you so much, Dr. Long. And I'm going to ask Dr. Guillon on his perspective on how Vietnam can develop as a medical tourism hub. Now, you know, there's been a lot of interest in medical tourism over the last, say, decade and a half. And clearly, ASEAN has been in the news in terms of lots of initiatives that the government of Singapore has taken, lots of initiatives from the Ministry of Health in Malaysia, lots happened in Thailand. India, of course, has become very, very important because of the high quality, competitive cost value proposition. So where do you see Vietnam emerging as a medical tourism hub?
When I first came to Vietnam in 1997, it was very different from what it is now. It's fun that you were talking about patient-centered care. Patient-centered care didn't exist at that time in Vietnam. It was doctor-centered care. So Vietnam has completely transformed its healthcare industry. Not only the private sector emerged and became very big, but also the public hospitals have been renovated, completely modified, and much better. So if somebody had been talking about medical tourism in Vietnam 20 years ago, 25 years ago, people would have thought, well, they are dreaming. It was impossible. Now it's very different. There is a number of very modern hospitals. Quality of care has improved considerably. Patient-centered care is normal. People think about it that way. Patients' rights, the way considering patient as a partner, all those things are very important and understood. Customer service, or what we call now patient experience, is something everybody understands is important. So there is a lot of factors that may play in favor of Vietnam to attract people from other countries. We also have a considerable amount of people next to us in Cambodia that want to come to Vietnam for many reasons. So cross-border medical tourism is already existing in Vietnam. But to attract people from other countries, what we need, in my view, is a government policy. Like in Thailand, basically the government in Thailand has helped developing the medical sector, has encouraged hospitals, has talked about the country, and hospitals like the Bangkok General Hospital, the Bumgrad, the Samitivej became places where tourists from everywhere in the world were coming. At the Bumgrad, we have patients from 173 countries, and everything is organized to welcome people. So I think we have to collaborate with the government if we want to really develop medical tourism in Vietnam, because we have the facilities, we have the doctors, we have the equipment, we are affordable, we are quick. I mean, when I see some people in my country, in France, they're telling me that they have to wait for 6 months to have an appointment for an MRI, I'm like, okay. And the same in the UK, the same in Australia, it's complicated for them. So, and also some things are expensive. So we have some medical tourists coming from Australia, from New Zealand, rarely from Europe, but we have a number of people coming to FV at least. We don't have a presence in the central Vietnam like Da Nang, where other tourists can go to their hospitals, but to Saigon we have a number of people, but I think we will need to have a collaboration with the government to develop the attractiveness of Vietnam, not only as a country, but also as a medical destination. Also, remember that there is a very large diaspora of Vietnamese around the world, and many of them come back to Vietnam very often, at least once a year, to see the family, etc. And those people would be very interested in having medical care in their country of origin. So I think there is a lot of potential for medical tourism in Vietnam.
And I'll ask any of our other panelists to comment on that, on medical tourism. If you have any thoughts you'd like to share.
I think for medical tourism in Vietnam, as Mr. Jean-Marcel said just now, we have all the components that we can start now, especially the government recently, the Ministry of Health and the Ministry of Tourism has organized a few events to collaborating to promoting medical tourism in Vietnam. Certain organizations like Vinmec healthcare system has been approached by the Ministry of Health to talk about how we can together promote quality in healthcare. And add to what Dr. Long just said is that we have to put the patient in the middle of everything. So we need to understand what do they search for when they are coming to Vietnam, a good medical care and a nice experiment, etc. So I think besides the fact that the government is now supporting this and having initial signal for us to move into this, I think together the local healthcare network has to work together as well to build a collaborating networks and also action plan on how we can move this thing forward. That is what I can share in my personal opinion.
Right. Yeah.
Yeah, I also like to just to add a few more from what Ms. Thuy and Dr. Jean-Marcel has just shared with us. We can clearly see that Vietnam has huge potentials for medical tourism. Apart from being a very favorite destination for tourism nowadays, where a lot of people come to Vietnam for holiday, we can certainly improve for medical tourism because nowadays, especially in the private healthcare sector like us, we are the kind of pioneer in the market in terms of improving the clinical excellence and improving the quality. We can serve the patients coming from other parts of the world. We got quality doctors, very good quality doctor across our network, private network. And also the equipment, the facilities are not much different where people in New Zealand, Australia or other country can see. And certainly the quality is number one, the customer service. And of course, the waiting time, like Jean-Marcel just mentioned, people don't just come and wait for a long time. And also, then the affordability. We serve a much lower cost in other countries. So certainly, that's a huge potential for us, for all of us to develop. But we cannot do it alone. We need to collaborate with the government and also other other sectors of the industry. So it's very good to know that the government now is put in the strategy and directions, putting more emphasis about developing the medical tourism, and then make it as one of the importance, even the driver for revenue factor as well for the country. And with that, I think the government can work, of course, play a very important role in policies, but also advocate the medical tourism. And then different sector industry like tourism and also other things like starting from the point when people apply for visa to come to Vietnam for the medical tourism or greet them from the airport. All those administrative processes make them feel welcome to come to Vietnam for medical procedure. All of that need to be together. And then also the tourism companies and associations would work with us, how we can bundle the packages together, offer very good hotel and other services so people can enjoy the beautiful scenes of Vietnam while having some other selective surgery or doing the orthodontics, plastic surgery, or other things, orthopedics, or even other choices as well. So this is a joint effort, but we are getting there. It's good that the government is backing us, but we also in our strategy of the private healthcare industry is also in our plan. So I'm very optimistic about that. I think I see huge potential, but of course there are a lot of work in front of us.
Absolutely, I think Vietnam's very well positioned. I think the tourism market in Vietnam has grown, connectivity has become better, getting visas is not very hard, people are very friendly, English gets you a fair way here, and that I think is very important because the medium of communication for patients who are coming from overseas matters. I think perhaps what Vietnam would have to do is identify key areas, niche areas, because the way I see it, you're looking really at medical tourism because you want to combine some elective procedures with tourism and the high-end medical value travel where somebody's coming in for a bone marrow transplant or very complicated cancer surgery or neurosurgery perhaps would be step 2, as there is maturity in the sector. We have a few questions coming up. So the first one is, what qualifies a hospital in Vietnam to claim to have become a center of excellence? Because this term center of excellence has come up a few times. Does the MOH provide a set of minimum criteria for COE quality standardization? Dr. Long, would you want to comment on that?
Firstly, I would like to add on regarding the medical reason, very short, because we have a Dr. Leung from the Ministry of Health over here, and we have one process of the government level, and we combine between the Ministry of Health and the Ministry of the Tourism, and we combine with the Ministry of the Security also, because we have to solve the problem regarding the visa, the medical visa for the aspect. And also, we have to do the marketing. That's why the Vietnamese ambassador at each country, they have to help the Ministry of Health to do the marketing in order that the foreign patient, the foreign customer, they understand what a Vietnamese healthcare industry we have. That is the first one. And regarding the benchmark now in Vietnam, a lot of public hospital also, they focus on the international standards. It looks like the Hung Vuong Hospital, that is the public hospital. In the women hospital, they got the JCI, or the blood and transfusion hospital in Ho Chi Minh City also, they get the JCI. That's why now a lot of hospitals in Vietnam, not only in the private hospital, they try to get the international standards. And the challenge, because I think we don't have enough time, that's why I try to talk about the one issue we have to face now, that is the human resource and the leadership, and how can we train the talent. And regarding the brand drain, that is the most difficulty to any hospital, not only in the private hospital. Because so far in Vietnam, even the big group in Vietnam, we have to face with that problem. Because when the new hospital open, we try to attract the good talent from the other hospital. And also, we have to attract from the public hospital. Because we know that one good doctor, it takes time to train them. But how can we solve this problem? I think we need to collaborate together, especially the PPP, the public-private partnership. Because we have a loss, the talent in the public hospital, but they don't know how to, they go to the private. At that time, we have to set up the public-private partnership, including the human resources. That is number one. And now we talk about the Asian, the Southeast Asia. How can we build excellent center in the healthcare in the Southeast Asia? I think in that case also, we have to connect the human resource within the Southeast Asia. That's why a lot of meeting at the HMA, we talk about the Southeast Asia community. And how can the doctor from Singapore or from Thailand, they can work in the Vietnam. Even the doctor from the Vietnam, they can work in the Singapore, Malaysia, or Thailand. And now we are facing with that problem. I think HMA, the next year, maybe we have one topic about this. How can we solve this issue? Because now, even now, in Vietnam, we have the new law of the healthcare. That is the version 2 of the healthcare. But we also have to face with that problem, because now the MOS, they say, the foreign doctor come to Vietnam, if they would like to get the permission over here, they have to speak Vietnamese fluently. I don't know how many foreign doctors they can speak fluently in Vietnamese. That is the one topic. Maybe next year, we hope that we have one topic about this. Thank you.
So important point in terms of breaking barriers. There's just so many barriers when it comes to healthcare delivery with the mobility of healthcare professionals from one country to another. But anyone want to answer the question on MOH criteria for Center of Excellence?
Yeah, let me take this questions. Well, the question has two components. The first component is what qualifies a hospital in Vietnam to claim to have a center of excellences. Well, first thing first, at this point of time, well, I'll share the experience from Vinmec healthcare system, because we do have a few center of excellences that we announce. So the practice is that we look into, for example, with the cardiology programs, we would look into the prevalence of disease. Well, let's say we look into the prevalence of acute care that we need to provide cares in the cardiology field, or heart failure is prevalent, is very high. And so what we have worked with the ACC standard is that we discuss with them. And under the discussions, we follow the standards, and then we standardize for PCI and heart failure, following the standards of ACC set of standards. And they come and review and accredit, and we monitor those indicator, a clinical outcome indicator, and we do participate into the international ACC's data registry, so that we continuously benchmark ourselves to the clinical communities. And then once we are accredited, then they would announce that we are accepted, we are accredited, and award as International Center of Excellency for this and that. So that is the current practice that we are doing in Vietnam. Yet, the Ministry of Health of Vietnam at this point of time does not have a set of criteria, to qualify the Center of Excellency, so-called, in Vietnam at this point of time. But we are moving into that, because the Ministry of Health is already start talking about criteria and etc. So we are confident that in the next few years that will happen in Vietnam as well.
Right, thank you, Ms. Ann. If I might ask Dr. Guillon, there's a question that's come up on medical tourism. Which countries would you really like to focus on? There's obviously clearly competition with Singapore, Thailand, Malaysia. So which countries would you want to pitch for?
I think the most interesting countries that could be attracted to Vietnam are those in the Pacific, Australia and New Zealand. And again, I repeat, people who are living in the US and Europe belong to the Vietnamese diaspora, because there are many of them, and they come very frequently to Vietnam. I think this is the focus we should have. Very easy to communicate to the Vietnamese community in the US, because they are very well organized. And I think we should have this in mind, because they are very interested in coming back to their country. And if we provide good healthcare at the same time, that would be very, very good. Trying to attract people from all over the world, like in Thailand, like they have been doing in the Middle East particularly, is a complicated task that takes a long time. You need to organize a number of things, like because of cultural issues, and also you really need to have a government doing a number of things to make Vietnam very attractive for those people. And as you said, administrative issues, issuing visas, welcoming people easily at the airport. A number of initiatives have to be taken in order to facilitate this.
Thank you. Yeah, very quickly, because we just have a couple of more questions coming up. Please go ahead.
Just something to add on that one. I think not just only attract patients coming to us, and also reverse the trend that Vietnamese people going overseas for treatment. Because every year, on average, the Vietnamese spend about over $2 billion overseas for treatments. I think first and foremost, we can keep them being treated in Vietnam, because we actually experienced where a customer of ours actually went to Singapore for oncology treatment, for cancer treatment. And then the doctors in Singapore have told them that they followed a similar protocol, and then the service in Vietnam actually quite good. They have asked them to come back in Vietnam. So that is also important target that we should also look at as well.
Sure. I'm going to come to Niru, and this is something that we wanted to touch on about patient centricity. So how do you see patient centricity? Everybody talks about it, actually becomes central.
Yeah, great question. I mean, we touched on it a little bit earlier about the importance of putting the patients at the center of care. But before I just touch on that, I just wanted to emphasize the importance of, before doing that, how important technology plays a role in all of this, because it is about connecting care. And before empowering the patient and be able to give patient centricity as part of healthcare, we need to have the right technology in place to enable that. And that starts really, from my perspective, with the foundation of an EMR. We talk a lot about AI and telemedicine and a lot of things happening at the moment. But really, without the foundation of a digital record, starting within a hospital or a set of hospitals or even the broader healthcare, the patient centricity does get impacted. I think from a hospital perspective, there's a patient centricity of care and how workforce can look after them and giving them the right care and their customer service, but also empowering them with the right technology to be able to engage by giving them the right trusted information. The education, the training goes a long way to actually giving a really good end-to-end experience for the patient. And therefore, giving patient centricity as part of the healthcare journey is very important. So from a technology perspective, I mean, it goes without saying, but it's a big enabler of patient centricity, but also overall healthcare evolving and hospitals evolving.
Well, thank you so much. At HMA, we pride ourselves in starting on time and finishing on time, so time's up. I'd like to thank Dr. Guillon, Dr. Long, Ms. Ann, Ms. Lien, Niru for sharing their perspective, and for everyone here for posting some questions. I'm sorry we couldn't take all of them, but I'm sure during the tea break, our panelists would be very happy to answer any questions that you might have. So thanks very much for this, and over to you, Natalie.
A very big thank you to our speakers and of course to Professor Anupam for taking us through this discussion.